This giveaway is to show my supporters that, you know, thank you for supporting me. Hey guys, so welcome back to my channel. If you are a returning subscriber, hey, and welcome back. If you are new here, hi, my name is Tatiana and I am a nursing student. Don't forget to like and subscribe to the channel. We're going to be starting off this video a little bit differently. I am going to be showing you guys everything that I have gotten for the giveaway winner, and yeah, so stay tuned as I walk you guys through what I got, me sending everything off, and yeah, so yeah, enjoy my week in the life video. So today I am going to be picking up the supplies that I will be giving away from my giveaway. So Josanne, I hope I'm saying it right. I'm gonna put it up here. Josanne, she was the first to comment on my latest videos, and she is a subscriber. So today we're going to be going to pick up the stuff for me to send out to her. We're going to be sending that off to her, so follow along with me as I go pick up the supplies and get everything packaged up so we can send it to her. So guys, don't forget to like and subscribe to the channel. I will be doing another giveaway once we reach 300 subscribers. As we grow and grow and grow, the giveaways will become bigger and bigger and bigger. So don't forget to like and subscribe to the channel, and don't forget to comment, you guys. You guys got to comment down below so I can know who you guys are, so I can be familiar with you guys. So it can better your chances of winning these giveaways, because I want to be able to give away things to people that support me. So don't forget to not only like my video, but subscribe to the channel and comment. It could be something small. Just comment down below so I can be able to get to know you guys. So just stay tuned while we go and get these supplies. Hey y'all, so I just came back from getting the stuff from Target. So you guys are going to watch me pack the items that I'm going to send to Josanne because she won the giveaway. Let me go grab my stethoscope. I'm back. All right, so as promised, I'm going to be giving my Littman away along with other items. So let's pack this box up. So this Littman, I may have used it like twice, and then I got a new one for my birthday that my husband got me, which was the Littman 3. So I mean, no point in me having 2 stethoscopes. So I got this planner, 2023 planner. Got this 2023 planner. Nice little stuff inside. Little stickers. Hope she will like it. So I'm gonna pack this in here. Pack the Littman. Then I did get some dividers. I did get a binder as well. Got some pens, some index cards, And then I got the college rule reinforced paper. They didn't have the one that I had in my actual supply haul when I went to Target, but this is something similar to it. So I have this as well. Like I said, the index cards. Binder rings for the index card. Highlighters. The pens from here. That's about it for what is in the box that I'm going to be sending for the giveaway. Like I said, the purpose of this giveaway is to show my supporters that, you know, thank you for supporting me. Especially with nursing school, you know, getting a lot of the items and stuff can be hard. But yeah, just like I said, if you guys don't forget to like and subscribe to my channel, and don't forget to comment down below. Like I said before, the next giveaway is going to be once I reach 300 subscribers, and yeah, each is gonna go up, 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 and the giveaways will become bigger and bigger, bigger. So don't forget to smash the like button, and don't forget to comment down below. She is from Trinidad, so I'm gonna be, like I said, I'm gonna be sending it there, and we'll get her reaction. So I hope she likes it. Hey guys, so today is a very, very special day. Today we will be sending off the package to Josanne, who was the winner of our first giveaway on this channel. Again, I thank Josanne so much for being a subscriber, a loyal subscriber of mine, and I just can't wait to ship this off, and I can't wait to be able to, you know, get her reaction on her items that she did receive. So watch me as I send this package off to Josanne. Hey, so I forgot to show me going into FedEx and shipping off the package, but I did, you guys, ship off the package. I was happy to ship it off. Never shipped anything international before, so that was different. But right now I'm just on my board doing right now my dosage and calculation questions, because like I said, in my previous video, my goal was to kind of hit dosage and calculations a little bit harder, and so I can be kind of more prepared when it comes to the quizzes and exams. So here I'm just writing down the dosage and calculation question. I'm just kind of reading it, and I'm just like, okay, let me figure out how I'm gonna do it. Yeah, I like the board because it kind of helps me like write my thoughts out, and then, you know, it's easier to erase than me using a ton of paper for it, than and, you know, wasting a lot of paper. So at least this way, I'm kind of working it out how I want to work it out, and if I'm, you know, messing up, I could just erase it. But once I find that method of how I want to do it, then I'll be all set. And I'll feel more comfortable, you know, writing it down versus me just, you know, wasting all that paper. But yeah, at this point, I'm pretty sure I end up getting the answer that I wanted. And so I'm just going to go back and underline certain sections of what I feel like I either need, what I needed, because a lot of the times they're distractor problems. So it's just a bunch of information that you don't need. And that was my problem. I was using the information that wasn't needed. So I'm just happy and proud of myself. Yeah. Hey. But I was just happy that I was able to figure that out, because y'all, dosage calculation was something I struggled with, but I'll be able to show you guys what I made on my fundamentals quiz. Um, so yeah. So your girl made an 80. I know, I know, I know, I know, I know. I'm just so happy. I made that 80, y'all, and I was happy when I found out that I made that 80 because that was the first 80 of the quarter. So it wasn't that many dosage calculation questions. There was only two, and I got one wrong because my decimal was, I put my decimal in the wrong spot, and I knew better, but I knew I was on the right track. That is what matters. Like I didn't just leave it blank this time, or I just was like, nah, forget it. I actually knew what I was doing. I just made that little mistake, and so I'm gonna be able to go back and tweak that, and so that mistake doesn't happen again, because it's very important about those decimal places and how I'm doing things. So I want to make sure that I get it done right, so I won't run into this issue again. So today I will be doing more dosage calculation questions. That's just gonna be part of my just normal routine of what I do. Like I said, once I get it down, I'll show you guys how I do my doses and calculations. But right now I'm not really comfortable, like, trying to show somebody else, because I'm kind of getting it. Like sometimes I get it, sometimes I don't. So once I get it, y'all, I'll be able to show y'all how I do it, and maybe it'll help you, because I kind of had to find my way of what makes sense to me and how I can do it my way versus, what my instructors show me. Like I try to do it their way, but sometimes it doesn't always click in my mind. I don't know why, but sometimes it clicks, sometimes it don't. So that's why I do it at home for like an hour or so, or hour or more, so I can be able to understand how I got that answer, and understand why I keep putting the wrong answer the way that I'm doing it, because you gotta, that's how I work. If I'm doing a problem wrong, I'd rather get it wrong and then and look back and be like, okay, so I missed this step right here. So I was on the right track, so I missed it right here. So let me just figure out what I'm doing wrong. So, and it helps me better to not make that mistake again. So a lot of the problems that I do work are distracted problems. So it's like a bunch of useless information that I don't need, but I used to just keep picking the information that I don't need rather than the information that I do need to get from there. So on this agenda today, I am going to take you guys through what it is, what shadow health looks like. You guys got like a brief overview, but I'll show you a more in-depth of what shadow health is. Like I said, I don't know for everybody's nursing program what it's like, if you guys even do shadow health, but I just feel like I can show you guys more in-depth in this week. I didn't get any lab footage, because honestly I didn't even go to lab to practice for checkoffs, because I was tired. I was extremely tired from work and just from that week in general, and I just needed me some rest. But needless to say, I did pass my checkoff for IV insertion and the removing and all of that stuff. So I did do good. So I was pretty confident in my IV insertion. So it wasn't that bad, because like I said in that last video, I forgot to take off the tourniquet when I was supposed to take it off. But other than that, it was pretty kind of straightforward about the IV insertion. I just have to, try it on a real person, but I am going to order me a IV kit so I can be able to practice more at home. So I would be more, I wouldn't be so antsy or whatever when I actually do it on a live person. So that's how I'm gonna practice with that. But I will get you guys over so you guys can see what shadow health is a little more in depth, so you can see what you're gonna be getting yourself into when you're doing shadow health. So you can be, okay, I've seen this before. Tatiana showed me. So I'll show you guys what shadow health, in depth of shadow health, and then I'll come back to you guys and chit chat about how I'm preparing for this upcoming exam too. Now we are on to looking at what is in her room that is not in the right spot how it's supposed to be. So, says you discovered a wheelchair which is placed away from the bed and it's not locked. So that's gonna be unsafe. Cause why is it away from grandma like that? What is it? Unsafe. And then I gotta put why, cause it's not grandma. Grandma can't do that with the wheelchair way over there and unlock. Grandma go fall. Grandma gonna fall. You don't want grandma to fall. Wheelchair. I gotta type too much because I'm not about to type too much. Because not me. Okay, you discovered this near the bed. Okay. I guess safe because it's near the bed. I don't personally think so, but sometimes shadow work does this thing. That's not safe. Book shouldn't be on the floor. Because it can call. So unsafe. Man, baby, we got this cord right here. Because, baby, it's several wires. And plus, he started fire. So, call light is on the side table and it's power to function. I personally think it should be a little bit closer, but now what else am I missing, y'all? Let's go around this room again. Oh, the socks. There's three. Yeah, because you want the point of the non-skid socks is to prevent her foot to prevent her from sliding. So yeah, now we can end this room assessment for grandma.
This tutorial
and then boom, we just gonna kind of like speed through this. Washing your hands, you're always supposed to wash your hands. While that's getting done, we can just look at what's going on with Miss Fisher, her S-bar and all of that. And good information to know. We look at her armband. She's fall risk. She's allergic to penicillin, and then also making sure that she's in the right patient. And then they just resolve the issues, which is move the wheelchair closer, remove the electrical cord, and yeah. So we're gonna just assess her vitals, Her blood pressure, which is going to be normal. It's going to be 120/80. Her heart rate, which is going to be normal. No, you're supposed to, typically when you're getting the O2 or your vital sign machine, you normally are able to get the heart rate and the O2, but this one is a little bit different. So you get the O2 saturations, which is going to be about 98%. No abnormal findings, which is 98%. And then you get a respiratory rate, which is going to be normal, about 16. Normally when you're doing the respiratory rate, you need to wait about 30 seconds and then multiply that times 2. And then you'll be able to get your respiratory rate. So yeah. Then you're gonna get her temperature, which is gonna be normothermic, 37 degrees Celsius. And then we're gonna get a vital sign readout, so you can type it out on our flow sheet under vitals. Her temperature is 37 degrees Celsius, 120/80. A little easy blood pressure. Heart rate 70. Respiratory rate is 16. And then for her O2 saturations is going to be 98%. And then the last vital sign, which is pain. So we're going to ask her, what is your pain on a scale of 1 to 10? And typically, like, ooh, yeah, it corrected me. But typically, when you're really out and about doing this, it'll go by faster. So yeah. So this is the interview guide, and it says the patient's status, and then we're just gonna ask, how are you doing? How are you doing today? Oh, she was so waiting, y'all. Okay. And then we're just gonna emphasize, like, that's great you went to a wedding. You went to a wedding. And we're just gonna say, just apologize for being tired, and we'll do our best to do this as quickly as possible. Man. Oh, she called me a sweetie, y'all. She called me a sweetie. So I'm just going to ask, what medications are you taking? Even though I can see that in the chart, you still want to make sure that the patient understands or knows what medications they're taking. And then we're just going to say thank you for that information. And then we're going to follow up with, then we're going to go back to ask, and then we're going to ask her what medication allergies does she have. And then, of course, she's going to say penicillin, but we just want to make sure she knows. And then we're on the wound assessment part. Okay, so now we're going to assess her wound. There's no drainage. There's no odor. And then we're just gonna follow up with questions. So, I'll just ask about, does she have a history of diabetes? Because the point of figuring that out is, with diabetes, it takes a while for wounds to heal. So it's important to understand why a wound is taking so long to heal, or if it's going to take a while to heal. Because typically with diabetes patients, wounds take a while to heal. And then we're going to ask, how long did she have this pressure ulcer? Okay, so we're gonna follow up with how long does the pain last? Okay, and then we'll follow up with her skin hygiene. So we'll just ask, do you normally have dry skin? We'll say thank you for the information. I don't know why I put a question mark. And then we're gonna go just dive into any stroke deficits, meaning since the stroke, what's been different. So. Since the stroke. Since the stroke. They asked me to talk about something, ask me a question. Any stroke deficits? So we're gonna come back to that. Like she's saying, since the stroke, part of her body is weak. So we're gonna follow up with what's been her recent activity level. And like I said, with this shadow health, I mean, this is a part of what you're gonna be doing for nursing school. So just be prepared for that, because I mean, it's gonna be either be ATIs or ATIs and shadow health or whatever. And it's asking me to educate her. Then I'll just follow up with it's important to keep a clutter-free zone to prevent to minimize her falling. And then I'll ask, does she currently need anything? And then I'll just emphasize I definitely have a sense issue with that. Spelled that wrong, y'all. I'm finna go back. And then I'll just come back once I finish up these questions. These interview questions, and I'll come back once I'm finished so y'all can be able to see the nursing intervention and SBAR. Nursing diagnosis short term. So now I'll be choosing like interventions that I feel like she should do, and then it shows this. The nursing diagnosis for is impaired skin integrity and impaired mobility. Short-term goals, the patient will describe measures to protect and heal the skin and care for her skin wound by the end of the day. The patient will be utilizing adaptive equipment and the assistance of staff to increase mobility by the end of the day, which is a good intervention. Then it says select 4 interventions that will help accomplish this goal with the expedient time frame. So educate the patient on repositioning the patient off her room. I would say, let's say, educate the patient and yeah, I think those are good ones. And then it says explain how the nursing interventions that I chose will work to help accomplish this. And the short-term goals that I'm trying to accomplish. stitches over here. The rationale behind it. And I think this is about the end of this. I will come to you guys. I will come back and talk to you guys about how I'm preparing for exam 2. So I will see you guys in a minute. Okay, so I am finished with my shower health. I did turn it in, and I'm all set. I'm all good. So now we're gonna be talking about how I'm preparing for unit exam 2 for fundamentals. You see, I got my pillow right here. I'm in my living room, and I'm about to get good and comfortable because I'm about to study. I'm about to study. I'm gonna do a couple of NCLEX style practice questions on top of doses and calculations. I'm more than likely going to spend about an hour, maybe 2, on just doses and calculations alone. I might do like between I'd probably say 60 to 100 NCLEX questions just over the chapters that we covered for fundamentals, so I can be prepared for the types of style questions that I'll be getting, because a lot of the times when it comes to exams, it's really about critical thinking, about choosing the right answer for that particular situation. You're not going to be able to memorize all of the information, but if you have the foundation of how to critically think, you'll be all right. You'll be able to choose the best answer for whatever question that you have. So me doing those NCLEX style questions prepare me for the exam. So whether I get any question that I come across, I'm just like, well, these 3 really don't make sense for this particular situation, so I'm gonna choose this. So a lot of times I might come across a question or 2 where I'm like, I have no idea what this is or how this is supposed to. I just read the whole question and just pick out key information on how I'll be able to choose the best situation for to choose the best answer for the situation. Critically thinking is the key. That's just key. If you can't critically think, you're gonna run into a hard time, especially in nursing school. So critically thinking is definitely gonna help you a lot here. So that's what I'm gonna be doing for how I'm gonna prepare for the exam. We're going to manifest, y'all. We're going to manifest making a, like, I'm saying like 80. I'm going to say an 80 on the unit exam. That is what I'm pushing for. That's what I'm hoping for. That's what I'm praying for. So, like I said, I have been doing the work to prepare for the exam, and I'll let you guys know how that goes in my next video. I do want to thank you guys for watching my video, and if you haven't already, don't forget to like, subscribe, and comment on my channel. Don't forget, I will be doing a giveaway once we reach 300 subscribers. That'll be my next giveaway, and I think we're about at 140 subscribers. So yay, thank you guys so much for subscribing to my channel, and that you're finding my videos worth subscribing to. The point of my videos is to just show a realistic point of view of what nursing school is like. Like, it's not all cute, and just like, some days, y'all, it'd be hard for me to try to pick up the camera and just, talk, but like this, picking up the camera and talking to you guys definitely helps me, especially with me going through nursing school. So I muster up that energy and I just keep it pushing. This concludes my video. I hope you guys liked my video, and just stay tuned for the next one. Thanks for watching. Bye.